Hi, I'm Dr. Rob Cushman, the Medical Officer of Health for the Renfrew County and District Health Unit. Now, today, I've got great news for everybody about the fantastic rollout of vaccines in Renfrew County. And I can't tell you how pleased I am. Some 24,000 people have received their first vaccine at this point, and probably about 2,000 have received their second vaccine. This is fantastic. We've had great response. We have vaccinated more than 82% of those over the age of 80. We vaccinated 3/4 of those over the age of 75. And we vaccinated roughly a little over half of those between the age of 70 and 74. So this is great news. We've really got superb coverage of our seniors. Those who are most at risk for COVID. And let me tell you, this is much better than elsewhere in Ontario. And the other thing I want to tell you is we've had a fantastic rollout of the AstraZeneca vaccine. Great pickup. People fully understand that the risks of the disease far outweigh any risk with this vaccine. So people have been showing up and they've been rolling up their sleeves. And I think we gave roughly 1,800 doses last week. Now, as you know, the supply for these vaccines is not always reliable. We got some Moderna this week, but there are peaks and valleys. But the good news is that the pharmacies will now be providing AstraZeneca vaccine to those over the age of 40. And we have a list here of the pharmacies. Look and find one in your neighborhood. And certainly you can contact them to see if they have a supply and if you can get vaccinated. And the other thing is, if you look at what's on the website, you can see you can actually click and you can have on it and have a direct connection with your pharmacy. Now, this has been a wonderful effort. I must say, I've got to thank the public. Your response has been superb. There's been hardly any vaccine hesitancy at this point, which we've seen. It's great. But there's a lot of hard work that's gone into this. And I really want to thank our 5 vaccination teams and the paramedics who deal with the rollout to specific spots. These folks have done a great job. We've had very close collaboration between all players in the healthcare sector. And not only that, a number of volunteers. And what's really impressive, actually, is how much better our collaboration has been than in some of our neighboring health units. I'm very proud of that. And for example, all of the allotment of AstraZeneca vaccine that the primary care groups got, these vaccines were delivered in our large clinics. And this is because of the tight integration between primary care, hospitals, EMS, public health, community health centers, you name it. We've had lots and lots of collaboration and contribution here. So this is great. Now, here we are. That's the great news. But on the end, I have to remind you that April has been a very busy month. Our numbers are not good. Hopefully, they'll be dampened in the final days because of the measures the province has taken. But we, as you know, are in the middle of wave 3, and we've seen a lot of variants, and these variants are very transmissible. I'm surprised by how many people at a workplace or in a family or amongst friends are getting infected with the introduction of a variant, much more than we saw before. So again, follow the public health measures. Certainly the hand washing. What's most important is stick to your family household. And if you're at work, be very, very careful. Watch out for downtime, spare time with your colleagues. As I've said before, we've seen the big problem right now is families, friends, and downtime at work. This is what's spreading the virus. So again, keep your physical distancing, use a mask, even use a mask outdoors if you're too close to someone, the hygiene, and follow all of these public health measures. But as I will say time and time again, don't think you're immune to this. There have been some very sick people who have been young people. There have been some deaths amongst young people. We've seen what it can do in pregnant women. This is a major concern, which underscores how important it is to stick to all the public health measures, the hand washing, the distancing, the masking, but in particular, keep your group small, tiny, with a lot of respect for having only the members of your household, only go out for essential shopping, and be extremely careful at work. And I'll just end on that note and say we continue with the vaccine rollout, but this is a war on two fronts. And while we're very pleased to say that probably a quarter of the entire population has been vaccinated, it's the public health measures that are really going to keep this virus at bay in the next probably 2 months. So I thank you for that, and keep up your participation. It's so important, because that is how we're going to get through this.